Hi, my name is Rayleigh Pickard, and today I'm going to be discussing briefly a change that I believe could be planned and implemented to improve healthcare as a whole. I'm then going to be discussing it using Lewin's change theory and breaking it down on a simpler level of all the steps that it would take to implement this change. The change I'm going to be discussing today is going to be early recognition and rapid response to sepsis treatment. This is a huge change that can be implemented into healthcare as it is drastically going to improve survival rates in the hospital. Sepsis is a leading cause of death in the hospital and in all kind of care facilities, and so early recognition and rapid response to sepsis could drastically improve patient survival rates overall. Using Lewin's change theory, we have to first look at the unfreeze step. Unfreeze is about creating awareness of the issue and fostering an environment that promotes the change and promotes a willingness to learn within all the staff that work at the facility. This requires an acknowledgement of a need for change. First, we have to break down everything that's going on. We have to tell our staff, this is what's going on, these are our issues, this is how we need to be moving forward. We have to be challenging the current practice. We have to show the staff that something is wrong, because no staff wants to completely change the way they're doing things. And so in order to get them willing and on board with this change, you have to show them this is a problem, this is the desired outcome to get over the problem and positively affect these patients. We need to be fostering a mindset of new ideas and acceptance of all the new things that are coming. The second step is going to be change. This is where we're going to start implementing protocols to start positively affecting these issues. So this is going to include coaching and training on all the new protocols and what we're going to do to establish change. For sepsis recognition and rapid response specifically, I would recommend a screening tool in the EHR that's going to immediately pop up that they're going to have to fill out. There's no way to avoid this to get through their EHR and chart the way they're supposed to. It's going to be a sepsis flag. It's going to monitor things like spiked vitals, spiked lab values, anything that's out of the ordinary that could indicate sepsis, it's going to flag this. We're also going to do rapid response training. We're going to teach our nurses, doctors, all the people of this facility, this is what we're going to do in this case. We're going to teach about antibiotic therapy as quick as possible, what antibiotics to give. We're going to train in rapid response, and we're going to train them into when to call the rapid response team in if they are available. We're also going to really focus on role modeling here. Our nurse leaders are really going to be pushing to show the nurses underneath their charge, this is what we're doing, because it's a lot easier to implement change when you're following somebody that you look up to that's also implementing change. Our final step is going to be refreeze. This is where we are going to make this the new norm. We want these new practices to be part of the culture at the facility that we work at. We want to reinforce good behavior. We want to praise successes. We want to hear patient testimonies of, y'all caught my sepsis early and I survived. This is what happened from it, We want to be a part of additional training. We want to keep enforcing the positivity that comes from the early recognition of sepsis and the rapid response and how this can affect patient lives in a positive way. Some of the barriers that we might run into is unwillingness to change or lack of knowledge. The easiest way to fix this in a workplace is to listen to feedback. We want to take the feedback from our nurses and we want to tell them, hey, we see that you need a little more help or you need a little more change from what we're doing. Maybe this isn't working. We want to listen and we want to go from there. We also want to really encourage ongoing training. We want to do on-the-spot training. If we see that someone's not grasping the concept or they're not doing it the way they're supposed to, we're really going to want to train there and work on that as quickly as possible. So that is how I think early recognition and rapid response of sepsis could be changed and affect our healthcare. Thank you very much.